Hi, everyone, and welcome to another Facebook Live with Lifeskills South Florida. My name is Amanda Bassos, and I am the Regional Clinical Outreach Director for Lifeskills South Florida. And for those who might be joining us for the first time, I'd like to take a quick moment to share a little bit about Lifeskills and who we are. So we are a treatment facility here in South Florida. We are dually licensed in that we provide clinical care for adults who present both with complex psychiatric use disorders and substance use disorders. And we offer a full continuum of care, including residential treatment and outpatient treatment, including partial hospitalization, intensive outpatient programming, and transitional living as an option for our clients. Now, given that we can serve adults with such complex presentations, both with mental health and addiction, we offer several evidence-based clinical pathways to support the clinical care that we provide. And those clinical pathways include dialectical behavioral therapy, cognitive behavioral therapy, cognitive remediation therapy, trauma, substance use, and metabolic fitness. Now, Lifeskills has been a trusted provider here in not just South Florida, but across the nation. And we are celebrating our 30th anniversary, our 30th birthday for that matter, this year. And we are so excited and humbled by the opportunity to provide the clinical care that we do and be a trusted resource across the world. Now, I'm excited that we're joined today by two members from our professional leadership team. And it's my privilege to introduce Lifeskills South Florida's Chief Executive Officer and licensed clinical social worker, Clay Weaver. Welcome, Clay.
Thank you, Amanda.
Yeah, we're so glad to have you taking the time to be a part of this. Thank you.
Well, good. I'm really I'm glad you brought up the 30 years. We've been around a while now. I guess we're entering middle age as an organization, so we're maturing.
So we are. We're very wise in the work that we do now, that's for sure. Well, I know that you have some really exciting news about our national team and our professional leadership, so I will turn it over to you.
Oh, thank you. Well, I think everyone that knows life skills, just the very fact that Kasey Stark is, her face is showing on the screen, people probably realize something is going on. And it is. I am very proud to announce, to let people know that Kasey has joined the Lifeskills leadership team and will be playing a leadership role for us as our National Director of Business Development. And we are excited that she is joining our team. We're going to ask Kasey to talk a little bit about herself, but just first, just want to say Kasey is coming to Lifeskills with a valuable national reputation. She is known nationally for what she has done. Kasey is also a social worker. That is what's great. I'm a social worker, so yeah, I'm partial to the social workers. Kasey is a social worker who has had three significant threads through her career and played major leadership roles within those. As an administrator, she has been a former executive director at Wellness Resource. She has been over compliance and quality improvement. So she knows organizational structure and administration and is an expert there. She also, in addition to that, has worked significant amounts of time in her career in admissions as an admissions director, very successfully. So she understands how to bring families into treatment and what support families need as they come in the door. And that's always different than what it looks like when families are entering in treatment, as they go into the treatment. There's a lot of special hand-holding individuals need through that entry process. And then Kasey has also developed a significant national reputation for her work in marketing with Acadia as the South Florida TPS. She is known all over the nation, and many people are fortunate to just have one area in their career where they're known as an expert and they excel. Kasey's coming to us, excelling in multiple areas and bringing all of those to play in her new role at Lifeskills. So, Kasey, we are excited to have you joining the Lifeskills team, and welcome to Lifeskills.
Well, thank you, Clay, for those kind words, and Amanda, you as well. I almost didn't know who you were talking about there for a minute. But no, in all reality and in all sincerity, thank you so much. And I, have really enjoyed my professional career, and I'm just so excited to have been able to continue to grow personally and professionally here at Lifeskills. And again, I've been in the behavioral health field about 15 years now. Clay pretty much summed up everything I've done, so thank you for that, Clay. But yes, I'm a master's level social worker, so I do have that background, as well as I'm a certified addictions professional. And the majority of my career has been spent helping clients and families struggling with addiction as well as mental health issues. So this is a great transition for me. And I'm just really excited to be here, and look forward to continuing to work and grow Lifeskills, especially in our 30th year.
Awesome. Yeah, perfect timing. I was thinking, Kasey, you have worked almost the first 5 months of the pandemic. You've worked in Acadia, helping families get into treatment, and now coming to Lifeskills. In 2 weeks now, you've hit the ground running, and you're involved in individuals coming to treatment here. Given the pandemic and what we're seeing at the national level, just want to ask you, what have you, over the past 5 months, what have you seen at the national level that's impacted individuals and families with complex mental health and addiction? What are you seeing that looks different than maybe pre-COVID?
Yeah, I mean, I think it's just been a really interesting time for all of us, especially folks that have been struggling. From a national level, it really occurs that folks are being increasingly impacted by the COVID pandemic, with symptoms being exacerbated, family, people being at home more often. So I think it's really kind of hard to hide people, your struggles right now. So I think we're just seeing a higher and higher acuity. I know that I've been receiving those calls more and more in the past 5 months. So I think, like I said, a lot of the isolation, not being able to get out socially, or go to work, or I think a lot of people have even possibly lost employment, which has impacted their well-being as well. So I definitely think that is a big trend in our industry, is people reaching out for help.
Yeah, I really think as individuals are coming in, I'm seeing the same thing with individuals and family members having higher anxiety on the family side. Is it going to work? How do we manage the virus or exposure? The individual's really struggling, and then the individual themselves, the symptoms they're presenting are so exacerbated and so acute that really at places like Lifeskills, that really is a national center of excellence with such a high number of clinicians with advanced degrees and PhDs and national certifications, it really does help to have that level of clinicians working with these families and with the individuals to help sort of stabilize some of that anxiety as they're coming into treatment. That expertise really helps people navigate the entry into treatment.
Absolutely.
Yeah, and I didn't know, Amanda, perhaps Clay can tell everyone a little bit more. I see some of our COVID supplies in the background. Clay, I didn't know if you wanted to talk a little bit about what we're doing over here, because I've just been very, very impressed with the level of seriousness and compliance that Lifeskills is taking for our clients at all of our levels of care.
Well, it certainly has changed our lives, and my office, as you can see on the left side of the screen, and that's just one small area, it's pretty much a staging area, except for the little seat right behind the desk. Everything else is boxes 4 and 5 feet in the air, mask and gloves and sanitizer, all of those things, but really keeping our staff safe so that they can provide healing, and they too can feel safe so that they can do that. And then keeping our clients safe so that they can receive healing. Those are the two most important things. So the wearing of masks, the spacing on the campus, spreading out the groups, all of those things we know, the sanitizing, all of those things that we take so serious. And then on the front end, making sure that every family, every client is spoken to by our medical director and he clears them individually. We go through a history of where they've been, where they currently are located, have they been exposed. Someone, for example, with current mania, if they're out on the street and they're going around, then we're going to bring them under what we would call a COVID protocol. They're going to have to go into an isolation house for several days until they have 2 negative tests and they can demonstrate that they're clean to then move into the larger community. So we're really taking these steps very seriously. Again, keeping our staff safe so that they can provide healing, and keeping our clients safe so they can receive healing. Two of the most important things, and it really has changed the way we function, and everyone around America as well, in the world.
That is well said, Clay. And I echo, Kasey's sentiment too, that, it's wonderful to see the incredible intentionality in the work, not just clinical work, but also the safety procedures and the safety care that is done on site for our staff and for our clients, and in turn their families. We say 30 years, to be able to provide the trusted treatment that we do. And that comes back to the leadership that you provide and that we have at Lifeskills South Florida and Odyssey Behavioral Health. So thank you, Clay, for your time and for that overview. And thank you, Kasey, for your time, and welcome to the Lifeskills South Florida family team. We truly are very excited to have you part of this family. And for anyone watching, if you have any additional questions about Lifeskills South Florida, our evidence-based clinical pathways, or any questions whatsoever, feel free to reach out to myself, to Kasey Stark, or to Clay Weaver. We are more than happy to answer any and all questions. So thank you all so much for joining, and we'll be in touch soon. Thank you, guys.
Thank you. Take care, everyone.